Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about the news and trends that are impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Courtney Breece, the AVP of Product Management in our payer business unit. This episode is part of our mini-series where we look specifically at 2025 and what our internal thought leaders predict will be top of mind in the healthcare technology space. Today, Courtney and I are going to talk about quality reporting. Thanks for being here today, Courtney.
Thanks, Justine. I'm always excited to talk about quality.
I know you are. I've been trying to get you on INOvators for like a year now, so certainly happy to have you here. But before we get too far into looking ahead at 2025, let's just take a minute to look back at 2024. Tell me, what are some of the quality measurement challenges that health plans really faced in 2024?
Well, Justine, there were two big ones. You may have heard in the news there was a major cyber incident that impacted pretty much everybody in the healthcare space. In particular, for those that were doing quality measurement, things really ground to a halt. And many health plans that do quality reporting had to ask for extensions. They went to NCQA, they went to CMS and said, hey, I don't have the data that I need to report on my quality performance. And so that was a really big one that was not anticipated. At the start of the year, if you had asked me in January of 2024, I wouldn't have said that would have been or had such a major impact. It also brought into questions around fairness. Some health plans got a little more time because they were impacted by the cyber attack than others. Many felt like because of the wide sweeping impacts that everybody was impacted and should have had a fair sort of shot at it with the extra time allowed. The other one was around the Star Ratings performance. If you read in the news and for Medicare health plans, there was a big dip in how the rating system was applied due to methodology changes. There were only 7 5-star plans ranked at the beginning of the year. That really had widespread impacts on the financial performance of those health plans. We saw stock tank for a lot of large health plans that lost their 4 and 5-star ratings. And there was a major pushback. There was lawsuits stemming from last year's star ratings that carried forward into this year. So those were two really big ones between that cyber attack and the changes in the star ratings program.
Yeah, absolutely. So looking forward and kind of focusing on performance, what would you say that payers need to really focus on as it relates to improving that performance?
One of the more interesting ones, and I like to get a little in the weeds, so hopefully this is understandable for the general audience here. There are a lot of quality measures that are moving away from sort of a more antiquated process around collecting chart review, and they're looking to get clinical data out of EHR systems. So the health plans are not just relying on the medical claims. So what do I mean there? So I go to a doctor's office, the doctor charges the health plan for that service, that office visit. The health plan doesn't always see what happens during that office visit. Did they treat that diabetic patient? Did they manage their blood pressure? Did they talk to them about their BMI? Any other interventions around their medication? So the health plans are always looking to get more and more information and data on their members, which is hard to do when they only have sort of the billing information or claims. So quality measurement's really moving to a place where it's not just relying on the medical claims, but also understanding clinical performance coming out of EHR. So health plans really need to focus on this industry switch to ensure they're getting clinical quality data out of their big health systems, out of some of the provider offices or EHR systems that are out there in the network that serve their members.
Are there any new measurements or requirements that they also need to be ready for?
There's quite a few. So a lot of those traditional measures, like the one that I described, let me give a couple of examples, like colorectal cancer screening. It's super important that members, once you hit a certain age, that you're having a colonoscopy. It's a great preventative measure to ensure that you don't have colon cancer, that you're catching it early enough so you don't have really negative impacts. That particular measure was switching from a traditional chart review measure to one of these electronic clinical data system measures measures, sort of in the digital measure space. So health plans were seeing really big impacts to their rates. So as the measure methodology changed, their rates were impacted. Well, that had the downstream effect of impacting Star's performance and other things. So health plans really need to understand how they're performing on these measures where methodology changes are happening. I'd say that's probably the biggest thing to be on the lookout in the quality measurement space.
Okay, so biggest prediction for quality measurement in 2025?
Oh, goodness. There's quite a few things going on. So we have a new administration that's coming in. There are some very significant differences in the Biden administration's platform around Medicare, ACA. I think there's going to be a lot of, not upheaval, but there are a lot of discussion down the street from us in DC around, where the dollars that are being spent in the Affordable Care Act and funding for ACA plans. And on the Medicare side, what does the future of those programs look like, especially in the quality reporting space? I think that's going to be a big one. On the measure changes, again, STARS, I don't think we're done hearing about the Medicare STARS program in the news, even outside of the administration change. I think there was such a big backlash from many of the health plans. It didn't feel like the rating system was serving their members, were clear and transparent on how those health plans were being rated. So I see a lot more public debate around the STARS program. What are the measures that really impact and drive improvement to the Medicare populations? I'm trying to think. On the STAR side too. So one of the initiatives on the Medicare Star Ratings methodology was a change where we're looking at socially at-risk Medicare members. So there was a program around Health Equity Index that is a factor into the Medicare STARS program. We really want to understand how those socially at-risk Medicare members are performing and how that's impacting the Medicare Star Ratings program. That's going to be another one. If you have a Medicare line of business, you really want to understand how that's going to impact your Medicare plan.
I think you gave me 3, but if you have any more, we can add one more in there.
No, I think that those are the big ones. Oh, actually, one more prediction. It'll be interesting too for those of you that are in the quality measurement space. There was a pretty big announcement. Peggy O'Kane is stepping down as the president of the National Committee for Quality Assurance. Peggy used to be my boss many, many years ago before I joined Inovalon. As the leader and major measure steward, at least for the HEDIS measurement set, Peggy has really set the groundwork and has been that, sort of the bar for which all health plans are measured. It'll be interesting to see under new leadership how NCQA moves their programs forward and evolves and really changes the quality measurement program. So that's something I'm going to be keeping an eye out. They are on a national search right now for a new president there, and it'll be interesting to see how that person can set the tone for quality measurement in the future.
Absolutely. It sounds like there's certainly a lot to keep a pulse on in 2025 around quality and a lot of potential change to come.
Yeah.
All right. Well, Courtney, certainly really exciting stuff here. Will be interesting, like I said, to see what comes of 2025, but just want to thank you for taking the time to share this insight with us.
It's my pleasure. Thanks.
And thank you to our audience for tuning in. Be sure to check out the other episodes of this Trends and Predictions miniseries.